Well, happening now, Chautauqua County sees a new COVID-19 case. We have the details there. Plus, a local doctor will join us live to talk about COVID-19 and what it's been like for health officials.
And the clouds continue across the area today, but some rain showers will be on the way this afternoon and much colder air by the weekend. We'll talk about it as the news at noon starts right now.
Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now. I'm Justin Gould. Want to start with some late-breaking news in regard to Governor Andrew Cuomo's daily update, where he made an announcement extending the moratorium on evictions both commercially and residentially in New York State until August 20th. We have full details right now at WNYNewsNow.com and on our mobile app. Back here in Chautauqua County, officials reported one new case of COVID-19 during their update yesterday. Here's the latest look at the COVID-19 outbreak map. Officials say the new case involves a woman in her 50s. There are now 38 confirmed cases, 3 active, 31 recovered, and 4 deaths related to the virus outbreak. Meanwhile, in Cattaraugus County, there was no new update issued yesterday. There remain a total of 43 confirmed cases, 12 of them active, 29 recovered, and 2 deaths reported. We remind you tomorrow at 3 o'clock, Chautauqua County health officials are scheduled to hold their weekly COVID-19 press briefing. Viewers can watch that live on WNYNewsNow.com, on our mobile app and Facebook page. Well, the Jamestown Tarp Skunks baseball team's inaugural season has been put on hold after their 2020 season was canceled due to COVID-19 concerns. The Perfect Game Collegiate Baseball League announced the decision last night. The Tarp Skunks are among 13 teams in that league impacted by this cancellation. Now, prior to the cancellation, the Tarp Skunks were preparing to return to league action after ownership of the Jamestown Jammers relocated to Milwaukee at the conclusion of their 2018 season. The team's general manager says that they have to put the health and safety of fans, players, coaches, and everyone involved first.
We were doing whatever we could to play. I think all our fans know that. And when it comes down to it, baseball is a game and health and safety is not. That's real life. You know, it just is what it is. It's not like World War II where you can play for morale. This virus is actually out there, as we all know.
Now, the Tarp Skunks say that they will continue with certain scheduled releases throughout the remainder of the year, and they hope to attend public appearances whenever it's safe to do so. Baseball was not the only sport that was put on hold due to COVID-19. Both the Jamestown Jackals basketball team and the Jamestown Rebels hockey team seasons were canceled earlier this year. Well, the coronavirus has killed more than 73,000 people nationwide in the U.S. That's according to Johns Hopkins University. And it's also crushed the country's economy. That's why many governors now are starting to reopen their states despite potential dangers that could come down the road. Our John Lawrence reports more from Washington.
President Trump calling the coronavirus one of the greatest threats the U.S. has ever seen.
This is worse than Pearl Harbor. This is worse than the World Trade Center. There's never been an attack like this.
Despite that, more than 40 states, all but the red ones on this map, will be at least partly reopened by this weekend.
I am concerned. I mean, we'll know in the next 3 to 4 weeks whether or not we will have even more of a surge than what we have now. But we're treating the virus in large part as if it's yesterday's news.
Over the past 2 weeks, 19 states saw an overall increase in reported coronavirus cases. 13 saw them drop, while 18 held steady, according to Johns Hopkins University data.
For states that are looking to reopen, I think it's important to lead with public health risk assessments. And so we have suggested that it should be low-risk activities that are the first that are reintroduced into the community. Things that are outside are a great place to start.
Time will tell if the reopening process will cause the virus to spread. Regardless, health officials say the threat isn't going away anytime soon.
We're just at the beginning of this pandemic and must focus on the future. There's only one enemy here, a dangerous microbe. It's us against them, humans against the virus.
I'm John Lawrence reporting.
John, thank you. Although President Trump recently said there's a chance that a vaccine could be ready before the end of the year, others, including infectious disease expert Dr. Anthony Fauci, says that 2021 is more likely. Well, health officials in Cattaraugus County have expanded their COVID-19 testing capabilities. The county's health department says in order to determine how prevalent the disease is in the community, officials have rolled out an enhanced testing process with additional testing locations, days of operation, and access to that testing for residents. Those who have COVID-19 symptoms are asked to get tests after speaking with their doctor first. Furthermore, anyone who has come in close contact with a known COVID-19 case should also be tested for infection. Healthcare workers, first responders, or other essential workers who directly interact with the public are also now encouraged to get tested. All testing requires pre-registration and an appointment. To register, you can visit catco.org/COVID-19-test, or you can give them a call at 716-938-9119. Now, after registration, patients will be contacted to schedule a testing time and locations. We have full details on our website right now. Officials say that this testing is not antibody testing, but rather testing to see if you have COVID-19. Well, students at Bush Elementary School have now created a video thanking their teachers amid this COVID-19 pandemic. Take a look. The children, as you see here, made signs saying how much they missed their teachers. They used several unique backgrounds in the video, which can be found in its entirety on Jamestown Public Schools' Facebook page. Schools throughout New York State now remain closed for the rest of this academic year as officials work to contain the virus outbreak. Well, hopefully everyone is having a good day, and we thank you so much for joining us here on WNY News Now as we continue to put facts over fear in our coverage of novel coronavirus. Got to say hello to TR. Hopefully you're doing well. Thanks so much for joining us on the broadcast today. Got to say hello to David. Good to see you. Good to see Tiffany on the broadcast. Hello to you. Hello to Jason. Hello to Jamie. Hello to Joseph and Butch. Hopefully you all are having a good day and enjoying it while you can. Let's now switch gears and get a check of our First Defense weather forecast. That's where we find Chief Forecaster Dakota Hunter. And man, Dakota, that is a beautiful pic you got there behind you.
It is. This was the sunset last night, thanks to our own Sean Sweatman, who pilots the Storm Interceptor. Man, how about this? Mother Nature has not been giving the best of herself over the past, week or two, maybe even this whole spring, but man, that was fantastic. We had a fantastic sunset across the area. Yeah, I had to break out the emojis for that one. And of course, if you have any videos or pictures of the weather, Hunters WX on Facebook or on Twitter or our weather page on Facebook for that. You can tell I'm ready for the weekend. Here's a look coming from the Mill Creek Mall Sky Vision camera. Traffic flowing okay over Peach Street. Lots of clouds around 56 in Erie right now with that dew point of 28. And even though the dew point is relatively low, we do have a little bit of moisture that's kind of heading our way, but I'm not 100% sure if a lot of it is actually falling. I'll show you the radar here in a second. 52 here in town right now, 55 over in Mayville, 58 in Erie, 56 in Warren, and also the same thing in Tidioute. And as we take a look at the radar, it does show these little light sprinkles moving through. I'm not 100% sure if a lot of this is falling. Actually, as of noon hour, the Erie Airport has not reported this. So what I think is happening here, because we have those dew points down in essentially down into the 20s and the 30s, I think some of this is virga. Again, we talked about that last week, how a lot of this might actually be kind of, not even be reaching the ground. It might be raining up at the cloud level, but maybe not at the ground level. But we're going to keep the chance for showers in there for the afternoon. 48 was the high yesterday. 30 was the low this morning. Not close to the record, though, which was 24 set back in 1989. Let's take you through the afternoon today. So mostly sunny early. The clouds have already started thickening up here. So yeah, not a whole lot of sunshine for the remainder of the afternoon. Scattered rain showers continue through the afternoon. Milder and breezy. 53 on the highest hills. Maybe when you get down to northwestern Pennsylvania, you might spike into the lower 60s. But it will be breezy though with a southwest wind 11 to 19 miles per hour. Jay, I'll throw it to you while I try to catch my tongue.
All right, Dakota, thanks. Coming up, a Jamestown doctor joins us live to give her expertise on the COVID-19 outbreak and its impacts here in Jamestown. Stay with us as WNY News Now continues.
With coverage that matters. This is WNY News Now.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
You're watching WNY News Now, your source for breaking news.
Welcome back to WNY News Now. The impact of the novel coronavirus outbreak has affected many over the past month, from those in education to small businesses to doctors and nurses on the front lines. Joining us on the broadcast to talk more about how COVID-19 is impacting medical professionals here in Jamestown is Dr. Betsy Kidder with the Chautauqua Center. Dr. Kidder, thank you so much for joining us today.
Thank you for having me.
Well, first off, since the outbreak began, how has practicing medicine changed for you and your staff?
It's really been a significant shift for us in the outpatient world. And I know for my colleagues around the county as well who practice outpatient medicine, we almost overnight had to figure out how to do medicine by video, medicine by telephone, get our patients queued up in order to be able to do that as well. Some of them don't always have the access to the digital technology that others do. And so that was a challenge for everyone, I think, in town trying to figure that out. And it's pretty remarkable. I think most practices, including ours, have done an outstanding job getting ourselves switched over to the digital world and figuring that out, and then pushing our insurance companies along the pathway as well in order to make sure that they're able to reimburse us for those types of services.
Now, in regard to COVID-19, it seems like federally what symptoms that we should be on the lookout for has evolved since the beginning of the outbreak. I ask, why is that? What symptoms should we watch out for now?
Yeah, it's really been a moving target from the beginning. I mean, we all are aware when this first hit that cough and fever were the real true symptoms to look out for and be worried about. But now it's just a matter of data. We've got more and more cases, we've got more and more information, and we've got certainly a bigger swath of symptoms that appear to be associated with this illness. Those include anything from pharyngitis, which is sore throat, myalgias, chills, loss of taste and smell. Sometimes we're even seeing GI symptoms like diarrhea be the presenting symptoms. So as the medical community, we've really had to shift our screening processes and how we evaluate some of our patients who call with symptoms with all of these new symptoms in mind. And of course, always taking into account these patients' other comorbidities, which means the other chronic diseases they suffer from, which may put them at higher risk.
Now, in regards to that diagnostic process, how does that work? If, say, someone in the community, one of your patients, was feeling sick, how would they now, under this new protocol, reach out to you and get an exam?
Yeah, we've done our best working with community partners to streamline this for the patients so that it's not such a difficult process. But right now, if you're having any sort of symptom, you should reach out to your primary care doctor. And they can easily write an order for a COVID-19 viral test, and they're able to fax that right over to our center. We have 2 testing centers at the Chautauqua Center, one in Jamestown, one in Dunkirk, and there's a 3rd center at UPMC who's also doing testing. And we call you the same day, get you in that afternoon for testing. And for those people without a primary care doctor, which there are many in our county, the Chautauqua Center is open doors to accept all new patients. We're happy to have you. And there is also a Find a Doc option that's been developed in our county for those people who are not sure how to find a new doctor, and they can call the Chautauqua Health Network. They have a number that's been advertised for Find a Doc.
Now, Dr. Kidder, this whole outbreak really has been so diverse in the fact that it's changed so much. In regards to treatment of COVID-19, I know there's a lot of information out there right now, but what do you recommend?
So from an outpatient perspective, we're not using any of the treatments you might have heard about in the news, such as remdesivir, which is the one that's gotten a lot of press lately. That's used in the inpatient setting for known cases in order to try and lessen the duration of symptoms. In the outpatient setting right now, we just treat our patients symptomatically. And that means if they're having some shortness of breath, we test them, obviously. They may need an inhaler. If they have COPD, we treat their COPD. We try and lessen their symptoms to keep them at home as long as possible in order to prevent them having to go into the hospital. There are no magic bullets in terms of an easy medicine to give in the outpatient setting. And like any major outbreak, illness, virus, we saw this back when HIV came out, there's lots of interesting studies going on right now. And scientists are getting creative, and it's fun to watch and see these studies develop, but there's certainly no slam dunk at this point.
Now, I would imagine you probably know a lot more about this than I do, but in regards to coming to an end to COVID-19 medically, just like the flu, a vaccine is probably what is needed. And the process to get to the vaccine and then eventually distribute it to people here in the area is something that at the federal level, they don't even know what's happening now. Is that the goal eventually, to get people vaccinated to get through this?
That's the only way I see us getting back to any semblance of what our old normal was. You're correct. It is very scientifically complex. It's logistically complex. It's going to cost a fortune. We essentially have to vaccinate the world. This is not just a United States problem. I can't imagine any of this happening, before the next 18 to 24 months. So I think we need to get comfortable in our new normal. We have to get good at trying to live life in our new normal and do as much job work we can and practice good medicine in new ways, shapes, and forms. And it's a challenge to us across the board.
Now, here we've seen a good number of people locally recover from the virus, some good news there, but we've also seen a number of people who have passed away. What makes people more susceptible to maybe getting COVID-19 and then seeing some serious side effects?
Yeah, so susceptibility to getting COVID-19, what we know so far is obviously if you have any underlying medical conditions that decreases your immune system response, that is a big component of being susceptible. That can be any sort of lung disease, asthma, COPD, diabetes, obesity. We've seen that cancer can play in here, as that suppresses the immune system. Any sort of autoimmune disease or being on chronic immunosuppressants can also affect that. And I'm sorry, the second part of your question was?
In addition to seeing some of these, we've seen a few deaths related here locally. Those people who maybe are passing away, I know county officials have, it's strange how they have to give out that information, but in the beginning they've reported that some of the people who passed away died because of an underlying condition. If a perfectly healthy person, would they die from COVID, or does it depend?
It's a good question. We think there may be a viral load associated here because we are seeing, for example, otherwise healthy healthcare workers workers who end up getting coronavirus and dying from it. We suspect that they've gotten coronavirus because of the very heavy viral load that they're exposed to on a daily basis. We also know that coronavirus in some people will tend to migrate deeper down into the respiratory pathways and cause an inflammatory response that is very hard to reverse. And that is usually what ends in death. And we don't always know if that's going to be a healthy person or somebody who's got some underlying health disease.
Gotcha. And I want to reference real quick, a viewer, Pat, in our comments is asking, because we mentioned that new normal, and I've had this conversation really for the last month with everybody from elected officials to medical personnel like yourself. That new normal, is that the masks and the social distancing?
I think social distancing for sure is going to have to continue. Right now, we've done an excellent job in Chautauqua County keeping our numbers down, I think in large part due to that social distancing. Wearing masks, I think at least for the coming 6 months is going to probably be part of all of our everyday norms. It's hard to tell. Really, I think it's going to be county by county, state by state in terms of what our cases look like and what our surge looks like through the summer and fall in terms of when we can start to potentially peel back some of those measures. It's every day is changing. We can't really put a good predictor for the future out there just yet, I don't think, because we're just waiting to see how this virus and this pandemic progresses in each of our communities.
Now, in addition to COVID-19, I imagine that people still have to go to the doctor for other things. Have you seen patients become more hesitant to visit, or does that telemedicine that we talked about a little earlier, does that quell those fears?
They are absolutely more hesitant to visit, and very, very grateful for the opportunity to do online telehealth visits so that they don't have to come out and be exposed, especially in a medical facility, which a lot of people want to try to avoid at a time like this. That said, we here at the Chautauqua Center, and I know my colleagues around town, are all open for business. We are still seeing patients in the office here if there is something that needs to be seen physically, if we need to lay hands on that patient, if they need a vaccine that needs to be given. We are always open to see them in those situations, and we do so carefully. We put a mask on them, we put a mask on ourselves, we wear gloves, we keep ourselves safe. But yes, it's certainly a changing environment for medicine, and we're doing our best to accommodate our patients' concerns.
Yeah. And finally, and we thank you so much for joining us today, what is your general message to the community and to your patients as we continue down this path?
I talk to my patients all day about this, and I tell them, be patient. This is an unprecedented time, and it's not going away anytime soon. We need to be calm. We need to be smart about it. We need to take all the precautions that we're given and be patient, because this is our next 2 years we're looking at least right now.
All right. Dr. Betsy Kidder with the Chautauqua Center here in Jamestown joining us today. Dr. Kidder, we appreciate your insight, worth more than gold. Thank you for being here.
Thanks for having me.
Now let's get a check of our weather forecast with Dakota.
Well, if you thought it's been cold so far this May, you are correct. We did the numbers on this morning. Now, understand these numbers are flawed because we're only 6 days into the month. But so far, our average high for the month is 55 degrees. When you take all the 6 days that we've gone through so far, that is 9.1 degrees below normal to where we should be right now as of this time with the average highs. We have not officially gauged anything at the Jamestown airport in terms of rain since May 1st, so we are running over 3/4 of an inch below normal precipitation so far for the month. But please understand those numbers are kind of skewed because we're very early into the month. Here's a live look from the Doubletree Hotel. Shows you just the clouds downtown right now. We're at 52 at the airport. This is going to be a factor today. The breeze is up out of the west at out of the southwest at 13 miles per hour. But look at this dew point at 24. The air is relatively dry, and as I showed you earlier, the radar has been showing maybe a few showers, but I think some of those might actually be evaporating as it comes down. But we will keep the chance for a few showers in this afternoon, so don't be surprised if you do get a couple showers or so this afternoon. It turns much colder tomorrow as a cold front actually moves across the region tonight that ushers in colder air. Something we've been talking about all week long. Saturday, record low maximum highs are likely across much of the southern tier. So far, the coldest May 9th on record so far is way back in 1902, where the high was 42 degrees. Look at this last point. Snow. Yeah, I put in the cursing emojis because this is just rude when you think about it. And winter just will not give up. I mean, look at this. We're going down to 38 on Saturday. And again, we've been mentioning this all week. If we are correct with this, and this verifies, this will be the coldest May 9th on record, dating all the way back to 1890. That is when active weather records started being kept here in the city. The airport actually didn't open until the 1930s, but weather records started being kept here back in 1890. But as we head into next week, we do see signs of it getting better. So just hang on. We're going to get there. Here's the radar right now. There are those, what I kind of call rain showers here. But again, I'm not so sure that a lot of these are actually falling. I think some of this is Virgo, where it's actually raining up at the cloud level. Remember, the radar is here at the Buffalo airport. It's shooting down this way. The radar beam is about a good 4,000 feet off the ground. So it might be raining at the cloud level. But I'm not so sure if a lot of that's actually falling. None of the airport locations have actually reported that. And you can see not a whole lot across the northeast, but clouds streaming in from our source region out of the west-northwest. And that will continue through the day here and especially into tomorrow. Let's take you through Future Scan. The model picks up on the idea of a few of those rain showers this afternoon. The rain showers will continue into tonight, but they will ultimately taper off. Tomorrow should start mainly dry, but then we'll get into another chance for a few rain and snow showers tomorrow afternoon. And then as we head into tomorrow night, it turns much colder. And then as we head into Saturday, look what pops up here. Snow! Aren't you just excited? I mean, you know, this is just almost like a rude thing to think about here. But again, notice some of these snow showers popping up here. Any accumulation should be light. I'll show you the snowfall accumulations in just a second. But then that'll ultimately all taper off as we head into Sunday. But we have upped the rain chances a little bit for Mother's Day. So here's what we're thinking right now in terms of snow accumulation. The one thing that's working against this is the ground temperatures are actually above freezing. So when that happens, a lot of this will likely melt as it comes down. But we're thinking if anybody sees anything about a half an inch across the lower elevations, maybe upwards of an inch. Maybe once you rise up into the highest hills of Cat County, you might see upwards of 1.5 inches. But again, this isn't a whole lot of snow by our standards. This is who cares kind of snow. But it is snow when you come to think of it. We're in May. But yeah, Mother Nature has a few things she has to say about that. So temperatures this afternoon in the inland areas, most everybody upper 50s. Maybe once you drop into Warren County, you might actually spike up into 60. They're at Warren and Tidioute there, but there will be a chance for a few showers with a southwest wind 10 to 20 miles per hour. The next 7 days of your life are on the screen right now. 52 tomorrow, 38 Saturday. And again, that'll be a record low max if we're correct with that. Mother's Day, we have upped the rain and snow chances to just a little bit, 35%, but still mainly cold. Monday, it still stinks, 41 degrees, rain and snow showers, but it gets better Tuesday and Wednesday as high pressure builds in. And look at that, we're back up into the upper 50s once again by next Wednesday. Justin?
Oh, Dakota. Thank you. You're just a messenger, my friend, but I appreciate it. Well, let's end the show on a lighter note. A longtime childhood tradition is coming to an end. Dum Dum's Lollipops is ending their prize program after nearly 70 years of holding it. The program began back in 1953, but it will now end on May 31st. Now, Akron Candy Company originally created Dum Dum's Lollipops back in 1924. Then the Spangler Candy Company bought them out in 1953 and started that prize program to help promote the lollipop. Now, the customers would exchange wrappers to buy toys and prizes at reduced prices, usually at those small-time candy shops that they bought the pops from. Well, the company stopped that back in 2016, but they were still able to enter codes from wrappers online and to get free and discounted items. Well, at least we can still enjoy Dum Dum Lollipops, albeit no free prizes. Hopefully everybody's having a good day, and we thank you so much for joining us here on WNY News Now. Wanted to take the last moment to answer a couple questions following the interview with Dr. Kidder. Pat asked, did she say 2 years? And she said probably 2 years for a vaccine, in her opinion. And she said the best way to get through COVID-19 is by having a vaccine. And then once everyone is vaccinated against it, the spread will be brought down significantly. That's going to do it for us today. News continues 24/7 at WNYNewsNow.com. We leave you with the live look over Chautauqua Lake. We're back here tomorrow for our TGIF edition. Hope to see you then.